Thanks for staying with us. Anna Shaw is here, and joining her now is Josh Pate-Terry, a hospice social worker. Welcome back, Anna, and welcome, Josh. So which members of the hospice team are responsible for providing care that's not related to the patient's physical well-being?
Right. So that's Josh and me in our hospice.
Awesome.
Some larger hospices will have a larger staff for that. We're a pretty small operation. So I'm the spiritual care and volunteer coordinator.
Okay.
And Josh is our hospice social worker.
Excellent. So can you talk a little bit about what volunteers do? What roles do volunteers play in the hospice program?
So each hospice can run that a little differently. Our volunteers provide primarily social support. So they're there to be a friend, play a game of cards, hold hands, go for a walk. Simple things that just a friend would do. And for a lot of patients, that may be one of the few friends they have. You know, we have patients who are in nursing homes all by themselves, and maybe all their family members have passed before them or live far away. So we try to really make sure those patients have volunteer support.
Awesome. So Josh, let's focus on the role of a social worker. What do social workers do for a hospice patient?
So social workers have, our job comes in a whole bunch of flavors. It'll start off a lot of times with assistance with end-of-life planning or access to community resources. But we also deal with all of the emotional and mental health aspects of care. Hospice care is very holistic, so we look at a wide variety of aspects of the patient's life. And so at one point I might be helping them apply for Meals on Wheels, and then at another we might be doing bereavement counseling for anticipatory grief or grief due to loss of ability.
So you mentioned bereavement counseling. So I know the hospice, the social workers can be also involved in helping with the family. What other roles do they play in helping, with the family members in addition to bereavement?
And caregiver support is a huge part of hospice, and a lot of that falls under my umbrella as a social worker. So I'm going to provide emotional and mental health support to caregivers, making sure that they don't suffer from caregiver fatigue. We're going to deal with any anticipatory grief, that's grief before the patient dies. And then I also do all of the bereavement counseling. So after the patient dies, I provide that counseling to those loved ones and caregivers as part of the hospice service.
Thank you. So inevitably part of the hospice process is the passing of the patient. And what do you all do to prepare the patient and the family for the patient's death?
So a lot of my job is going to be about using their strengths. This is going to be a strength-based system. We want to look at what are your strengths, what are your coping tools that have worked for you in the past, and how can we use those to make this transition as comfortable as possible. And this is both for the patient and the caregivers. It's going to be a lot of give and take. It's going to be about getting a feel for what's the best in this particular situation, and then just providing that care and that support.
So hospice care obviously doesn't end when the patient passes. Can you talk about, and I think you hit on this earlier, Anna, but about the grief and bereavement counseling that happens, even after the patient passes?
So part of our role as a hospice organization, part of our requirements is that we provide bereavement care for 13 months after the patient passes away. In my organization, we get a little more leeway. I can provide that care beyond that 13 months. And we also provide care to the community. But what would happen is a client would come in after their loved one passes away, and I would do a bereavement assessment. And that would give me sort of a roadmap of where they're at in the bereavement process. And then when we would build whatever tools necessary based on that, whether it's counseling or if it's something more serious or intense of a grief process.
Thank you. So this is a controversial topic, but physician-assisted suicide is legal in some states, Montana being one of them. And I would imagine because of the care you all provide that there may have been instances where someone has sought counseling around this particular subject. How do you and your team address this situation?
So it's important to know right now in Montana, Physician-assisted suicide is legal because of a court ruling, but there's no legislative basis for it. So we don't know of any physicians who are willing to test that.
Sure.
And it's really, we certainly have had patients ask about it, but it's not part of our goals in hospice. What we want to do through the care that we give is make it more desirable to live out the natural lifespan than to choose something like that. And we can do that with pain control. We can help with other symptoms that, that may be distressing for a patient, addressing their environment, making sure that it's safe and comfortable for them, and supporting the people around them. And most of the time, we find that's enough for people, and that's what they really need.
That's wonderful. Thank you. We're about out of time, but maybe each of you could summarize in a few sentences any final thoughts that you might have that you'd like our viewers to hear. Josh?
Biggest thing for me as a social worker is that bereavement services are probably one of the more important tools that we have and probably the most underutilized. So don't be afraid to take advantage of bereavement.
Wonderful. Perfect.
Yeah. For me, something that's important to know and something that really inspires me is that hospice care is the same for everyone. It doesn't matter if you are, a former elected official, or if you're homeless, or the color of your skin, or the life that you've had. Everybody is offered the best care that we can give. And to me, that should be how we function all the time in this world.
Agree. Thank you both. Your passion is quite evident. Thank you for being here. We want to thank Roxanne for being here as well. And of course, thank you for tuning in this morning. We'll hope you'll come back and see us again next week. In the meantime, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.